we go. Okay, good evening. Hi there. Hi, everyone. Okay, so we'll just wait for everyone to get the notifications and come on board. And hey, Izzy, thanks for joining, girl. Megan Joy, Diva Beauty, thanks for joining. Wensha, Katlejo, hi. So we've got, after our for those of you that has joined us on the weekend, on Sunday we had an extremely amazing event on Sunday. So one of our doctors that did a talk was Dr. Tebogo Deo from Genesis Fertility. And I just thought I'm going to go on just a few minutes before the time because I've got load shedding. So just in case, I've got everything sorted just before lights go off. So there were questions that was given in by some of our attendees. And I said to them that I would do the Q A this evening. And we can answer some of the questions for those that we obviously just ran out of time on Sunday. So I thought, okay, let's do it now. So maybe you're watching now or you're watching the talk later. This will be on our Instagram, or otherwise we will have it on our YouTube. So I'm just going to, doctor's joined us now, so I'm just going to add her. She sent a, there we go. There we go. Where are you, doctor? When the doctor to accept. No, just go. Now that's accepted, doctor. And of guys for joining. So we are going to go live with Dr. Tebogo Deo. We're just waiting for us to go on board. Come on board. And if you've just got problems, there we go. Getting your request, doctor, and I am accepting it. So I don't know if you need to change. You need to go live on another platform, but it's not allowing. Yeah, it says you are unable to join, doctor. So maybe let me send you a request to one of your other accounts. Log in with another account and then just send me a request and I'll accept it. So let me go through some of the questions. It was one of the questions we have is, could you have PCOS and endometriosis at the same time? Okay, that was one of the questions we got from the ladies that joined us. That joined us on the weekend on Sunday at our Fertility Solutions VIP event. And that was one of it. So we're going to ask this question. Okay.
There we go.
Hi there. Are you? Can you see? I can't see you, doctor.
Really? I can see you.
Is it okay? I don't know if the ladies can actually see. I think you need to turn on your video. Let me just see. Here we go. There's a video on. So I think you need to turn on your video because we can hear you, but we can't see you.
Really? My video,
yeah.
I can see you on my screen and
I see you on my screen.
Can you see me on your screen?
No, we can't see you. We can just hear you, doctor. I think your video must be off. So you need to just turn on your video camera itself. There's a little under right on top. You'll see.
I've switched it on now. And now?
Maybe we just wait for it. Let me see. Still not showing. We can see both. Oh, they say we can see both of us.
Yes.
Okay, we can see and hear. Okay, awesome. People are saying they can see both of us.
Okay.
I think it's still just not showing on my side. Well, that's fine, doc. So I wish I could have seen you. You always look so pretty, but I'll see you afterwards, obviously.
Yes.
So thank you for joining us on Sunday. It was an amazing event.
It was
I hope you enjoyed it.
very much so. I enjoyed myself. I hope the ladies that came to join us also enjoyed themselves. And thank
Yes.
you, Magugu. We can see that we can see both of us. Thank you.
Awesome. Yeah, I've got such a lot of feedback from a lot of ladies. So I think most of them are here because they want to get some answers to the questions that they gave us on Sunday that we weren't able to get through. So
Okay.
I'm going to go through some of the questions. First question we have is, could you have PCOS and endometriosis as well?
Before I answer the question, Leanne, I just want to put a disclaimer that this is not in any way replacing a consultation. This is not in any way a full-on medical advice. So it's just answering questions based on what you're answering me now. At the end of the day, to get a comprehensive assessment, a person still needs to go and consult with a reproductive specialist. So can you get endometriosis and PCOS? And the answer is yes, it is possible. They are not necessarily mutually exclusive, and one doesn't prevent you from getting the other. It is possible to get both endometriosis and PCOS, yes.
Okay, perfect. The next question is, with PCOS, is it always the case that you have, could you have your periods twice in a month?
So, yeah, I saw that question that says that can you get 2 periods in a month?
Yes.
So PCOS is characterized by irregular periods, and irregular periods can come in any form. It can come as a short period, but most of the time it is typified by what we call oligomenorrhea, which means that you get fewer cycles. We now know that the latest guideline says that you must get 8 cycles in a year. That means that one every second month. So usually people get longer periods, but it is possible that you can get irregular periods. And remember that just irregular periods, missing your period, seeing more than 1 period in a month on its own does not necessarily mean PCOS. You still have to get you have to get 2 of the signs, hyperandrogenism, which can be acne or hair growth, as well as the PCO on ultrasound. And now the latest one is that you must also get elevated AMH. So irregular periods on its own is not equal to PCOS, but it can be part of PCOS, yes.
Okay, thank you, doctor. And then the next question is, how do you produce more eggs? I'm going to ask it exactly the way it's put. Because I understand that situation, but I'm going to ask the question exactly how they've asked the question.
Okay, yeah. So I saw the question. It's like during the IVF cycle, how do you get to make more eggs? So remember, the number of eggs that you are going to produce is dependent on your intrafollicular count, which you cannot create, as well as your baseline AMH level. So according to what baseline you have, if we've scanned you and we've found 3 intrafollicles, that's how much you are going to make. But depending on the dose of the medication that you are being given and the kind of protocol that we use, yes, some protocols, we know that some drugs can produce a little bit more, but a little bit more, like maybe 2 more eggs. It's not like a huge difference than the others, and some protocols can give a little bit more of the eggs, but a little bit, really not statistically significant, like maybe 1 or 2 more eggs extra.
Okay, thanks, Doc. Is it recommended, is it possible to have endometriosis but doctor does not see it in an ultrasound? Will endometriosis that is not seen on an ultrasound affect the success rate of my IVF? My embryos were graded as A, B.
Can you get endometriosis and we don't see it on ultrasound? Yes. Endometriosis is not a diagnosis that is done by ultrasound unless you have endometriosis of the ovaries, what we call endometriomas. When you have those chocolate cysts in the ovaries, then that's when we can see the endometriosis. But in general, it is a diagnosis that is made on clinical usually the pain and the infertility, as well as laparoscopy, when we have to operatively go and look, put that camera in the belly button, and when we see those lesions, then we can confirm that you have endometriosis. So it is possible that you can have endometriosis and we don't pick it up on ultrasound. And yes, endometriosis can affect the outcome of fertility. It does not necessarily affect the quality of the egg itself, I mean of the embryo itself, because we can't say because you've got endometriosis you are going to have poor embryos. No. But if your AMH is low, if your age, you are further on in age, or if there's other genetic issues, then a person may have poor grade of embryos.
Okay. And does a diet have an impact on endometriosis and the symptoms and its progression?
The studies that have suggested that a diet that is high in dietary fats, with meats, especially red meat, some are suggesting that even poultry can lead in progression or worsening of the endometriosis, whereas diet that is higher in fiber, in zinc, calcium, magnesium, omega, plant fats, your avocados, your seeds, your nuts can improve the endometriosis. Yes, so like I said, vitamin E, D, and zinc, but it doesn't mean you are now going to pop pills. Rather, you go for healthy eating. Sugary foods also, and can also make the inflammation worse, and as a result, make the endometriosis worse.
Okay. I'll be 41 before 1 year ends. Been trying to conceive for the past 3 years. I was diagnosed with stage 4 endometriosis and adenomyosis in June, and right fallopian tubes has toxins from menstrual blood. What was told I won't be able to conceive naturally. What are my options?
So again, this is one of those that it is not easy to just give a straightforward answer. It is better if a person is assessed by the reproductive specialist to be able to tell. But most likely, if you have endometriosis plus adenomyosis, it probably is better to remove. And if I'm understanding you well, to say the tube is full of menstrual endotoxin, I'm thinking you mean hydrosalpinx, then you have to remove that one. So we probably have to do surgery before, and then based on the AMH, then and age, I would then recommend that you do in vitro fertilization. It does not necessarily mean you cannot fall pregnant, because if the endometriosis is successfully removed and the other tube is fine, there is a chance of falling pregnant. But remember, with age, your fertility potential drops. So actually, it is better to go for IVF, where then you can be able to harvest eggs, and then you can tell whether you'll be able to fall pregnant, if you can afford it.
Yes. Okay. Does the male undergo a sperm wash after every failed IVF cycle, or sperm wash only happens once?
I was wondering what that means by sperm wash, because sperm wash to us mean one thing, and I'm not sure what whether they're talking about spermiogram, or because with every IVF we actually need fresh sperm. So if we are just talking, do you get to prepare the sperm with every IVF cycle for as long as we're harvesting the eggs? The answer is yes. But for us, when you say sperm washing, we are thinking HIV. In that case, then, if we are doing sperm washing for HIV, then we freeze the straws. And depending on the number of straws, we usually will thaw 2 straws per cycle. So if you have 8 straws, then obviously you don't need to wash every time. But if you only have 2 straws, so then so the washing depends on the number of straws. But with every fresh IVF, yes, you will need to prepare the sperm. But if you have embryos, then definitely it's not necessary to prepare the sperm every time.
Okay, thank you. What is the normal level of AMH?
Okay, AMH above 1. So we usually say 1.1 is if we are just looking at what are the chances that you would be able to produce eggs. So if we have AMH more than 1.1, then we are happy that we will most probably be able to to produce eggs. But having said that, we look at it in conjunction, like I'm saying, with FSH. We look at it in conjunction with the ultra count. So on its own, if let's say you have low AMH on its own, it does not necessarily equals to we are not going to go ahead. We automatically have to go for donor eggs. So there's a whole number of factors that we look at before we can say your AMH is too low or whatever it is that we cannot use your own eggs.
Okay. And then I think it's the last two questions is, does age and other uterus factors, in other words, PCOS, adenomyosis, endometriosis, have an impact on the disability of the baby?
No. Age, yes. Age, yes. Both age of the mother and the father, actually. So we know that after the age of 35, the chances of aneuploidy goes up. So aneuploidy, I'm talking Down syndrome and other abnormalities. And now we also know that when the man is older, there's a higher risk of autism and, you know, all those other mental conditions that we were not aware of before. So the older the parents are, the higher the chances of abnormalities, yes.
Yes, it's just the age. And then please define excessive alcohol or smoking.
No, okay, smoking is a no-no, period, you know. So anything that, you know, as long if it's got nicotine in it, there's no excessive or smoking must just stop. Yes. Alcohol, you're talking at about 1 or 2 glasses a week. That would be enough if you are planning to do IVF, but more than that, it's too much.
Okay. I've got one question here that I really think we should ask is, are there any long-term side effects of IVF?
That's a very interesting one, that one here. I was wondering what this person had in mind. Did they think that will they develop cancer or, you know, anything like that? There has not been anything that has been reported that people, because maybe of the high estrogen levels or anything like that, or because of the hormones that you are on, you are more at risk of developing such conditions compared to a general person. So I have not come with a substantive evidence that suggests that it is definitely detrimental, because if it was, then we would have to inform you that you are doing this to your detriment, that something could go wrong with you.
Okay, thank you, doctor. There's one last question I think we have time for. It is, Angels just asked, my partner is 40 and I'm 33. Will it be pretty difficult for us to conceive?
That's actually not an easy question, because on age alone, it doesn't say, you know. So you still have to go for assessment, Angel. We have to look at your hormones. We have to look at your tubes. We have to, you know, check your womb, uterus, to see that there's no fibroids, polyps, PCOS, you know. And we also have to look at your partner's sperm. And then based on these, and also I would say that I'm assuming you are already trying, and you should have tried for at least a year before we can say that you have fertility issues. So on age alone, that doesn't really tell me anything.
Yes. And then she's also asked, do they test male partners as well for fertility? So this is a very good question. So I'm actually glad she asked that.
Yes, because fertility is a couple issue, provided you are in a heterosexual relationship. So when you come in as a couple, you're trying to conceive, then we will test both the male and the female, because you need a healthy sperm. So we need to look at all the parameters of the sperm to make sure that they are fine. First, to confirm there is sperm, the man is producing sperm. And second, to make sure that that sperm that's been produced is being transported. And then all the other parameters, we also look at their infective markers, we look at their lifestyle. They have to stop smoking, weight, and drinking, you know, sitting in the jacuzzi. So we do a full assessment of the man as well as of the woman, because it takes two to tango.
Okay. Doctor, I don't know, do you want to answer one last question?
Not a problem.
Okay, thank you. Hi, is it necessarily recommended to do a laparoscopy with diminished ovarian reserve and hydrosulfics? Could you please say that word before IVF?
Okay, so I guess the laparoscopy there would be done to remove the hydrosalpinx, because it has been shown that removing the hydrosalpinx can improve your chances of implantation. So the laparoscopy would be done for the tube, actually, not necessarily for the ovaries. So if you are saying, should I rather go and do the IVF first and then go and remove the tube, that's a possibility. If you're thinking that is there a risk that removing the tube could further diminish my ovarian reserve, yeah, maybe. Then that means that you do the IVF, but you don't put back the embryo, you freeze them, and then you go and remove the tube before you actually put back the tube. Yeah.
Okay, that's a very good answer. Thank you very much, Dr. Deo. I really, really appreciate all your input. You've been really awesome these last few days, just actually last few weeks, where you've just been available for us and trying to help as many women as possible. And I'm glad you said at the beginning of your talk, where you said that they still need to come. This is just, we're trying to give some advice, but it's very difficult when you actually you don't see the patient themselves.
Correct.
So you're trying to help as much as you can, but you do recommend that they still would need to come for a consultation.
Correct. And thank you very much for having me, and I'm hoping that this has been helpful for somebody out there. It has clarified some matters with you. We cannot be able to give you all the information. Like I said, this does not in any way replace a consultation, but at least it can allay your fears and maybe give you a direction. And please make sure that you always go to a reproductive specialist. Don't be stuck with somebody who is just a generalist while you know that you're having fertility issues. And all the best to you, ladies. I hope that one of these days you hold your dreams in your hands.
Oh, thank you very much, Doctor. Could you please just leave your details of how they can contact you if they'd like to book an appointment with you?
Okay, you can contact us at reception at Dr. Deo, which is drdeo.co.za. Otherwise, if you around Pretoria, also 012-367-4364, or if you just go to Genesis website, you can then also be able to contact the ladies there, www.genesisart.co.za. Thank you very much and good night.
Thank you very much, Doctor. And then if any of you have questions, you can always just DM me with the questions and I'll try and get it over to Doctor. But thanks very much, everyone, and thanks, Doctor. Have a great evening.
Thank you.
Bye.
Bye.
Bye.